Hi, I'm Dr. Angie. I am a holistic veterinarian and I am here to answer your questions. Let's see. I just got a notification. Oh, let's see. Okay, Jojo, does this look okay? I just got this strange notification. Now that you're on here. Forever yours. Welcome. Let's talk about your pets. I have some questions that were sent in, but I would love to know how I can help you. If you are watching the replay, you can leave a message in the comment, and I go live around 12:30 on Wednesdays. Sometimes it's a little bit later. Mountain Standard Time. I am in Boulder. Let's see. Aw, thank you. Do we get to meet in person? Let's see. Okay. There we go. I have a few questions, but I'm interested on how I can help you. So leave your message in the comments. Leave your question. April says, what is the best food for a dog that has just been diagnosed with diabetes? Dog is currently eating Nutrisource High Plains Small Bites. Hello, animals of the earth. I love that. Welcome. I'm answering questions. Someone is at my door. Okay. Okay, let me look up this food. Super distracting. High Plains Small Bites. Let's do it. Okay, I'm going to get to your question about feline arthritis. Okay, well, the first thing while I'm looking up this diet, because I just kind of want to see what's in it, and then I'm going to answer your question about your dog with reflux. Okay, so the most important thing with diabetes is just to get testing, like blood glucose testing and insulin down, and that can take some time. So you guys are hearing my automatic litter box scoop. It is, of course, right next to my desk. And every time I go live, my cats decide that's the best time to use the box. Let me see. I'm just looking this diet up. I mean, I would say, I don't know if I would switch any diet. Like, I don't know that I would switch away from this diet. And I would probably work on regulating. For some dogs, a higher fiber diet can help. But I think that I would first focus on getting your dog regulated. Then if you can't get your pup regulated, then think about doing some switching. But I think what you're feeding is okay. Okay, so back to feline arthritis. The cool thing is we're getting more and more tools in our toolbox for cats with arthritis. I really like CBD. And if you go to, let's see, Boulder Holistic Vet, go to my website, I sell a CBD for cats. That is my favorite. There are a lot of good CBDs out there. The problem with a lot of them with kitties is the palatability, because cannabis inherently tastes a little bit skunky, marijuana-y. And so that's my favorite one. It also comes in a chew, but I think financially I would just get the oil because you're getting so much more. These are what the chews look like. And see here, let me open. I have an open bottle here. And so there are these little chews and they're cute. They're cute. They're heart-shaped. But you're going to get 1 milligram out of here and of CBD, and then you're paying for the treat. So if your cat is saying, I'm not going to have the other stuff on my food, definitely do the chews. But to save you money and we can get more CBD into your cat for less money, that's what I recommend. The other thing I really like for cats that especially have more severe arthritis is a new drug called Silencia. I've been giving M and N CBD, but it hasn't been helping. Well, let's see how much you've been giving. Let me pull that up. M and N's CBD. Yes, so it's RX vitamins. Let's see. Okay, so I'm going to put it in here. RX vitamins for pets, and then it's their feline, they're the Hemp RX feline drops. And then let me see how much you've been giving. And I don't know, Jojo, if you're still on, if you can drop a link in. Okay. I am not seeing that brand. Let me Google. For some reason, my browser just thinks I want Yahoo to be my backup. Let's see. Okay, CBD oil. Oh, is it M&M's? Snoopy's Pet Supplies and Grooming. Hey. Okay, M&M Dispensary, maybe? Let's see. Okay, our ingredients. Cold pressed CBD oil, organic, full spectrum. Oh, they make CBD chocolate. I want some of that. I take a very expensive amount of CBD every day. And once I started taking it, like I could not take it because I felt so much better on it. And so now I'm just hooked on an expensive amount every day. What I don't see is how much, like what their product is and how much CBD you're giving. Okay, good. So Jojo just put in the comments, you can see in the feed here, the feline drops. That's what I like. And for a 10-pound cat, I would start with 2 drops or 2 milligrams. It's the same thing, twice a day. There's 1 milligram in each drop. Okay, so the other thing that I really like for arthritis is a new injection called Silencia. And it is changing the game for cats. We don't have like Advil for cats because it ruins their kidneys. And so we haven't had, like cats haven't had access to the same type of drugs that dogs have access to. And I've seen a lot of kitties do really well with Silencia. And I'm going to put I think you should talk to your veterinarian about this. Like do all the things. Silencia. Massage can be really helpful. Acupuncture. You've heard of that, but you're a little bit nervous about it. Yeah, the only thing that I've seen happen is that for some cats it works in the beginning and then stops working, and that's a bummer. But I haven't seen anything go awry with it. What I have seen most of the time is I've had my own regret that I haven't started it for some of my patients sooner, just because they feel so much better. The other thing you could try is acupuncture, laser. I don't know, how old's your kitty and how bad is their arthritis? Okay, and then I'm going to go back to, let's see, okay, we're going to go, while we're doing this, we're going to go back to the reflux question. My dog has acid reflux and was diagnosed with gastroenteritis. his TLI was greater than 50. His HESCA food sensitivity test is a HESCA food sensitivity test a good way to go about deciding the best diet? Ugh, no. Gosh, I wish it was. It would make my days so much easier if we could just test for food allergies. But no. There's no good way to test for food allergies, which is it's like a really bummer fact. It's a super big bummer. But I have here, send me an email. And I can kind of give you my protocol of how I do food allergy testing. I use a certain diet. Let's see. Yeah. But unfortunately, we just don't have a good test for food allergies, which is such a bummer. And then the gastroenteritis, it's like we really don't know what's going on with your dog. That's a very, like, it's just inflammation, it doesn't help us, but something's going on. Has your veterinary team talked about doing an endoscopy? Have they talked about doing hydrolyzed diets? I have a lot of opinions about hydrolyzed diets. We were just talking about arthritis in cats. I think that's the flavor of the day. Okay, what do I recommend for arthritis in cats? Number one is CBD. I really like CBD. And Jojo, can you throw that link again in the comments? CBD is just one of my favorites, especially for senior cats. I think it helps with their mental health. And the other thing I've been liking lately is Silencia. And it's a newer pharmaceutical. And it is a once-a-month injection. And it helps with the pain of arthritis. And it's been such a game changer for so many cats. I'm actually even starting to use it for senior cats that are like urinating outside of the litter box. I think senior cats have a hard time getting in and out of the litter box, and sometimes they'll start peeing outside for that reason. Now, you didn't tell me that your cat was a senior. I'm just assuming so. So please correct me if I'm wrong. Hey, Sam. I would say most senior cats have arthritis. Whether or not we recognize it is a problem that cats really have to deal with. Let's see. No, that simply recommended I stop her raw food diet and switch her to Purino Gastro food, which I didn't think was the best way to go. Do you see clients in Boulder? I'm not too far away. Yeah, send me an email. Thank you. He's a senior feral, so I won't be able to do the injection. Okay. That's okay. Why don't we start with some CBD? Okay, so he's your feral kitty outside. Let's see. Jojo, are you still on? I wonder if we could get a coupon code. Like, we're just talking about HempRx drops this whole session. Let's see if we can get you some. Let me see if Jojo's still on. Okay, but Nicole, don't go anywhere. Okay. Let's start with the HempRx. We'll get you a coupon code for it and go from there. Because I know with feral kitties, you're limited, and I know you probably don't want to start catching this feral kitty once a month for a Silencia injection, although I think it would make him feel so much better. My cat is in total protest, chewing on everything right now. Does anyone else cats, do they do that? Is it just me and my kitty? Probably not. Let's see. Oh, yeah, you're welcome. I also, and maybe, I don't know if there are any other cat enthusiasts in here. Thoughts on elk antler powder for arthritis. I have never used it. Let me see. I have a database I can look, see if anyone else likes it. Oh my gosh. Kitty, stop doing that. Fritz. Let's see. Clinical evaluation of powder of quality elk velvet antler for treatment of osteoarthritis in dogs. Let's see. Okay, so this is a very small study. A powder of quality elk velvet antler. This is also from 2004. This is a long time ago. Clinical evaluation. Okay, it was evaluated on client-owned dogs with osteoarthritis in a clinical, double-blind, and placebo-controlled study. 13 dogs received placebo for 30 days, and then the antler for 60 days. 25 other dogs received the antler for 60 days. Gait analysis measured with force plate, clinical signs assessed by orthopedic surgeon, performed in daily life activities, and vitality assessed by owners. And a complete blood analysis were obtained at day 0, 30, and 60. On the placebo, 13 dogs did not show significant improvement. However, their gait, their performance in daily activities, and their vitality were significantly improved on the antler based on changes in the values exceeding those observed when placebo was administered. The 25 no clinical changes were revealed on blood analysis. Administration was effective in alleviating the condition in arthritis. I don't even like the way that this is translated. I don't know where this was done. I don't know. Use the code BHVLive25 for 25% off all CBD products. Oh, definitely do that. Hey, Molly. Molly's Little Shop. Authentically Bee. Welcome. I mean, I haven't used it, but that doesn't mean it doesn't work. Let's see if anyone else is using it. Okay, here, this is someone who was using it 12 years ago. Here's a holistic veterinarian. I'm going to see what they think of it. Yeah, they don't use it either. I don't know. I don't know if it would hurt anything. I wonder, is it expensive? Where do you get it? Hey, Rob. Okay, I have a couple other questions I think I need to get to as well. Yeah, but let me know if you use it and you think it's helpful. I would definitely like to know. Okay, Brooke asks, can you discuss the safest option for flea and tick prevention? I live in North Carolina where year-round prevention is necessary. I polled many local pet parents, friends, and the director of my dog's rescue organization, and everyone is using NexGard. Are there concerns with this option? Okay, will the CBD help with being nervous? Yes. I don't know if it'll help a feral cat just be not feral, but yes, it will. The CBD link be in your bio? Sorry, I don't know how lives work. Oh, that's okay. Jojo, will you throw the link in one more time? See, you can just do the link from here. Or you can go to boulderholisticvet.com. And if you go to the shop page, you can go to CBD and then you can use that coupon. Okay, the safest, is NexGard safe for fleas and ticks? I mean, kind of. So in North Carolina, you have a lot of parasites. You have a lot of mutant fleas and ticks. I think that for the most part, it's pretty safe. It does come with a black box warning on it. For some animals, dogs and cats, it causes neurological problems. And so I think it's one of those kind of informed consent type of things. Like I feel like our veterinarians should be telling their clients about this so that you can know that the FDA has put a black box warning on them. So if you decide, I actually don't want to participate in that, when I send my patients from Colorado to Connecticut, I will use this class of drugs because I want to prevent Lyme's disease. But that being said, if you don't want to, there are still other products that should be effective. Can you guys hear my cat just making the ball go round and round in his toy? It's just more protest. It's also really cute though. So if you don't want to use that class of drugs, then you could use something like Frontline. I think the risk you run doing that is that maybe it's less effective. Like I wonder if the parasites there are more mutant than they are here. In Colorado, Frontline works just fine still. And it doesn't have the FDA black box warning on it. And so I think it's one of those things, like, I mean, JoJo, my nurse in this chat right now, she uses NexGard because she does not want any parasites. And I think for her, it's worth it. And of course, her dogs have been fine on NexGard. But I think it's important to know that black box warning is there. And if you have a dog or a cat with seizures or any neurological problems, I would not use it. So, yes. Okay, Brooke, let me know if you have any follow-up questions to that. Okay, let's see. Wesley and Caitlin, or maybe it's all one. Caitlin, Wesley, I'm not sure. Hi, I'm really getting in the whole holistic side of things. Welcome. My 6-year-old golden retriever. Hey, Barbara. My 6-year-old golden retriever has heartworms because I accidentally missed one dose of medicine. Oh, I'm sorry. You must live in the South. Is there any natural effective way to kill heartworms? Hey, R8 pups. Good to see you. Jojo says, after having lice in the house, I will forever use NexGard. Yes. Yes. Yeah, I forgot about the lice you had. It was so gross. Yeah. Okay. Your dog has heartworms and you want to know if there's anything natural. Not so much. Now, if you have a much older dog, sometimes we'll just use like a slow kill method that, of course, the American Heartworm Association is never going to support that. But if you have a younger dog, we definitely want to kill those heartworms because we do not want them affecting your dog's heart function over time. And it's also important to know what kind of burden, like worm burden, is that your dog has. But if you want to go through the pros and cons of each, I'm happy to look over your dog's records and, we can make a plan. The slow kill method is just about giving them preventative every month. And so over time, the idea is that you're killing the babies. And so once the mature adults die, then you should be over time killing it. Now, killing the infection. I use that method very selectively, but honestly, we really just don't treat a lot of heartworm disease in Colorado that was obtained in Colorado, if that makes sense. Dogs can come from other states, heartworm positive, but they rarely get infected here, just probably because the mosquitoes don't live that long. We just don't have enough oxygen, would be my guess. Although I wonder with global warming if that is going to change. Does anybody else have any questions? Definitely use that code, the coupon code, BHV Live 25 to get 25% off if you use CBD or if you want to use CBD. I'm going to put it in here one more time. And only you guys will have it. And why do vets do a test before giving heartworm prevention? Oh my gosh, I have so many big feelings about this topic. I don't know. I mean, I do know, but I don't agree with it. Okay, so when we test them and they're heartworm positive, one of the first things we do is we put them on ivermectin, which is heartworm prevention. And for some very rare moments and situations, dogs can have a reaction as all the larvae die. So ivermectin is just killing the young form. If too much of them die, it could theoretically, or maybe has in the past, caused maybe anaphylaxis, maybe a stroke. I don't know. And so then there's this idea that like, oh, you cannot start prevention. And I remember early on in practice, I've been practicing for 17 years now. Early on, we would like gather the blood and, you know, like run the test. Or if we would send them off, I'd be like, okay, here's your heart guard, but don't give your dog any heart guard until I call you. And I don't know, because now, if, you know, even then, if dogs turned positive, we would start them on other medications too, but we would also start them on heartworm prevention. I don't know. I don't ever withhold heartworm prevention for a test. I don't get it. I think it's important to know if your dog has heartworm, and I get that. But I don't get withholding prevention, which is just ivermectin, by the way. Like, I don't understand that in this profession. I think it is prohibitive, and it just really irritates me, because when people are trying to prevent this disease that we're trying to prevent, and it's actually easy to prevent, and then we make it hard, I don't like it. So I don't know, maybe a lot of other veterinarians would have a reason, or they said they saw this case one day, but I know that I start dogs that are heartworm positive on heartworm prevention, and I just think that we should give out heartworm prevention. I mean, I know it can't be free because we have to buy it, and we should test. You should get your dog tested every year if you can, but that should not be the thing that prevents you from preventing heartworm. So, yeah, I don't know. I don't know why. Jojo, do you have any thoughts on it? Why do we still do this? I think it irritates people too, because the prevention's so expensive. Get the off-brand if you need to. It does not matter. It's just ivermectin. I mean, first of all, preventing heartworms is expensive, and then, you know, we're asking to have a test, and for some dogs, getting blood is really traumatizing. I just have a whole soapbox. So that's probably, Molly, more than you wanted to know. Does anybody else have any questions? I have thoughts, but it's not very PC. Totally. I don't get it. Never. Okay, good. I'm glad. You're probably like, whoa, I just met this person. That's a rant I didn't need. I don't have too many of those. Well, maybe I do have a lot of those, but if I have a doctor-patient relationship, then I will definitely prescribe heartworm prevention. Okay, does anyone else have any questions? If you want me to look over your dog or cat's records and make some individual recommendations, you can go to boulderholisticvet.com and go to, oh my God, Molly. Okay. I didn't know. How are you? Okay. So you know me. Molly and I grew up together. Her dad was our band instructor. Okay. Also good. We should catch up off of Instagram. But if you want me to give you a plan for your dog or cat specifically for them, you can go to boulderholisticvet.com and you can book a video consultation with me. I will collect your pet's records. We'll meet on Zoom. It's all recorded. We'll send you the recording. And yeah. It's really helpful for a lot of people. I spend a lot of my day helping people put together kind of all the pieces of their pet's healthcare. Unfortunately, a lot of veterinarians just don't have time in the exam room to go over everyone's questions. And so I spend a lot of time doing that, just kind of giving you the backstory, just like I did with Molly. Okay, I go live around 12:30 every Wednesday, definitely by 12:45. Oh, do you work with cats that have feline hyperesthesia? I do. I really like CBD. That's one of the first things I do for hyperesthesia is CBD. Sometimes acupuncture. I will use drugs like amitriptyline. I do all types of things for hyperesthesia, but that can be really hard on kitties. I feel bad for them. Gabapentin can sometimes be helpful. Okay. Well, if you guys don't have any more questions, I will see you next week for our same lunchtime. I'll talk to you soon. Bye.